to talk about, what's been on my mind this week. It's been a pretty, I think, heavy last couple of days, in terms of just the amount of death that we've been witnessing. I mean, throughout the whole pandemic, but I think in a concentrated period, the last 4 days have been really intense. And I think if you're a music lover, we were just talking about music. Friday would have been pretty hard for you because a musical icon for me and for many people, American rapper DMX passed away. And DMX was just this touchstone of rap music because he was really a kind of blues musician in rap music. His lyricism, persona, rooted in this kind of existentialist posture, which we could have a whole conversation about DMX and what he meant for the culture. But I think his artistry was really a turning point for the genre, and he passed away in an untimely fashion. He was only 50 years old. And then, yesterday, a South African writer, Phumlani Pikoli, passed away. We've spoken about some of his work on the show before. He wrote that book, Born Freeloaders, which is a sort of critique of South Africa's young Black middle class. And on Sunday, Dr. Sindi van Zyl, who's affectionately known by South Africans as the People's Doctor, passed away. And I think what was noteworthy about her passing is that a week before, there was a crowdfunding campaign that had been put together to try and help raise funds to cover her medical bill because she had been hospitalized since the start of the year, having contracted COVID, and due to persistent breathing problems, needed to be kept on a ventilator. And this campaign was started. 2 million Rand was required to settle the medical bill. Half of that was raised, and then she unfortunately passed away. And I think what it sort of just, I think, underscores, which is a message that everyone preaches about what this virus is supposed to make clear for all of us, but sometimes doesn't really sink in all the time. It's just the nature of how fragile we are as human beings, but also how fragile people are no matter what their station in life is in terms of access to healthcare. I think in South Africa, it's interesting because I think when the crowdfunding campaign was started for Dr. Sindi, I think some people reacted skeptically and were wondering, well, why do they need to go to a private hospital? What's wrong with going to a public South African hospital? Because the nature of private healthcare in South Africa is that as a for-profit system, it is incredibly exorbitant. But I think it just goes to show how the way capitalism structures our lives is that it places these impersonal pressures on all people to try and strive for commoditized services. And it's designed to diminish confidence in the state provision of services and to compel people to believe that you'll get better healthcare, better transportation, better schooling if you go for the private and marketized options. So naturally, people go to extreme lengths to try and access those services. But in many instances, no matter what their class position, those are still extremely expensive and have extreme barriers to entry. And someone like Dr. Sindi, who'd spent so much of her life trying to extend her own expertise, extend her own services to people free of charge, was now in a position where when she needed help, she didn't have a safe, quality resource in order to access that. So I think I'm increasingly becoming convinced that as South Africans, as we make the demands for universal healthcare, for example, it also needs to be universal healthcare, not just to provide provision for the people that need it most, but healthcare that undercuts the power of the private sector, that demarketizes access to healthcare, and that creates a system where people can trust that no matter what station in life they're in, they can access the vital things that they need in order to survive. So I think there's a lot of work to do, but I also think that there's a lot of people that the left in South Africa can reach in terms of the demands that it makes upon the state and demands that it makes upon capital.